The United States is the only country of the 51 deemed highly developed by the United Nations that lacks universal health care. With this robust of an outlier, it strongly suggests that we need to reconsider our options. Recently, Senator Bernie Sanders has proposed his idea for the Medicare for All Act, which would provide universal health care in a different manner. However, this manner is similar to those ideas already in place in Europe, such as Germany. While the support is growing, the opposition is still strongly high in the United States. I claim that the United States followed the rest of the developed world and adopted a universal healthcare system. Implementing universal healthcare into the United States would first give access to treatment for all citizens, and secondly, it would benefit the economy. So firstly, universal healthcare would provide coverage to all citizens, which would benefit everyone's lives. Currently in the United States, according to the Centers for Disease Control and Prevention, 12.4% of people aged 18 to 64 were uninsured, which totals to about 25 million citizens without insurance. In 1948, the World Health Organization declared that access to healthcare was a basic human right. Yet, in the United States, millions still do not have this access to this basic right. Universal coverage would ensure that every U.S. citizen gets their basic right, as it is a founding principle of our nation. Looking at a policy employed by Germany, who has a lower GDP per capita than the United States at 50,200 compared to 59,500, according to the CIA, the trouble is in the migration and not the money. In Germany, there's a mix of public and private funds people go into that ultimately allows the coverage of everyone while being supervised by the government. This shows that in Germany, with a lower GDP per capita, the United States can afford to service universal health care to its citizens, then so can the United States. For citizens, this creates an opportunity without discrimination based on economic status, because you would go into a public or private fund funded by everyone instead of trying to pay a single insurance premium by yourself. Additionally, adopting universal health care will eliminate co-payments that deter people from seeking care or harm them financially. When a person is put into the hospital, their first priority should be getting better and not worrying about their emergency bill. Looking at a case study by the American Cancer Society, one patient had her side of the cost at $10,114 in co-payments and premiums, while already having an insurance plan in place. However, many citizens, even with this insurance plan, would not be able to afford that cost. And if they did not have an insurance policy already in place, the cost was over $140,000, which for the average citizen, no one would be able to pay for that amount. From a published article on the prevalence of medical bankruptcies, the naive prevalence of medical bankruptcy is 23.1%, but exceeds 50% when accounting for misclassification. By implementing a universal healthcare system, this would not be an issue, providing financial security and peace to thousands when they need it most. Secondly, universal healthcare would benefit the economy by aiding businesses in overall worker productivity. In the United States, about 56% of people have their healthcare based by their employer. By switching to a universal healthcare system, the business would no longer have to directly provide coverage for its employees. The business of Coalition for Single-Payer Healthcare claims that with a single-payer healthcare system, employer labor costs could be reduced 10 to 12%. And following this up, an article written by Tony Johnson, a journalist on U.S. policy, some economists say these moving dollar figures pose a heavy burden on companies doing business in the United States and can put them at a substantial competitive disadvantage in the international marketplace. By switching to universal healthcare, the business would not only benefit from a direct reduction in costs, but as well this could provide an economic boost, as more companies are encouraged to move or start up in the United States without the added cost of insurance. Furthermore, the economy will benefit from the overall state of health provided by universal coverage. The Center for Disease Control and Prevention claims that 69 million workers reported missing days each year due to illness. This loss of productivity reduces economic output by $260 billion per year. Of these 69 million workers, many will have already had health insurance. However, universal coverage will give them the confidence to see a doctor for preventative care because they will not have the fear of a copayment deterring them. Additionally, of these 69 million workers, millions will already not have health care, and getting universal coverage will now cover them. In conclusion, universal health care in the United States would benefit both the people and the economy. People would have their human rights granted and greater financial security in case of an accident. Additionally, the switch would save businesses money on labor, as well as maintain a healthier workforce, boosting productivity. For these reasons, the United States should implement universal health care. Thank you.
Thank you. Okay, well, let's start off with the elephant in the room, as they say. This is a proposition of policy, not a proposition of fact. It wouldn't be hard to make it a claim of fact when you look at the secondary points that you have, which are factual claims, making a claim of future fact about what would happen if this was the condition. So I think you needed to make an adjustment in the proposition, so that's a little bit problematic. There's a good preview of what the supporting structure is going to be. That's fine. It's just two claims that you're dealing with, although each of those claims ends up having a bunch of multiple or a bunch of minor claims underneath them that probably get a little bit overwhelming and might need to be structured a little bit more. I know that I told people not to overdo it on some of those secondary or minor points, but it feels a little bit like you've got 6 things that you're talking about on the first point and at least 4 issues that you're talking about on the second point, and there's a tendency for some of that information to run together. I did think you did a good job citing information for the most part, information about the availability of insurance, for instance, the number of people who are uninsured, the relationship between the number of people who are uninsured and some of the problems that you're talking about needs to be stronger. For example, on that last point, you mentioned 69 million people miss some days at work each year due to illness. We don't know what percentage of those people were without insurance, and as a consequence, we don't know if there's a difference between people who had insurance and people who didn't have insurance when it comes to that particular point. So that's just an example of something that I think would make your argument stronger if you could make that correlation. The argument earlier had a couple of examples that I thought worked pretty well when you were talking about what the cost would be to people for accessing this without the insurance. Obviously, there's some certainly prohibitive costs. There is a presupposition here that the 12%, for instance, that don't have insurance don't have access to health care. They may not have access to some health care, but they certainly have access to other health care, and that's one of those things that's a little bit unclear because you mentioned, for instance, in Germany, it's a combination of private and public sorts of assistance, and I'm going, well, that's sort of the same thing that we have here. I guess the difference is how much you're paying or how much comes from one group versus the other group. And if everybody has, like you talk about the people who are poor, they have access through Medicaid or other healthcare systems that are designed to assist the poor, and people who have access to health insurance, they have access through health insurance. So I'm kind of trying to figure out where that middle group is that's missing that, and that seems to be where all the harms are supposed to be occurring. The other argument about the economic benefit, it's kind of speculative. I think that it's not a bad idea. Of course, we have other costs that are being borne here that might be different. So the comparison to Germany, for instance, is an interesting one, but I didn't get any of that economic comparison between the United States and other countries, just kind of a general statement that if the companies didn't have this overhead, that would give them some long-term benefit. So probably a good argument, just could use some better, more specific information on that point. All right, thank you.